welcome back, friends. October is Substance Abuse Prevention Month, and one organization is really on a mission to support those in crisis. It is my pleasure to have Anthony from Samaritas joining me. Thank you so much for calling in. How are you, Anthony?
I'm doing well. How are you doing today?
I'm doing great. Thank you so much for being here. Now, how dire is substance abuse in Michigan? How many Michiganders are really affected by this?
Yeah, it's the numbers are pretty staggering. It's
Yeah.
over a million, I believe. The research, I want to say, it's 12.3% of Michigan adults meet diagnosis for a substance use disorder. So it has definitely been an issue for years and decades, but also with pandemic and changes, it has only gotten worse.
Yeah, Anthony, what are some of the challenges when it comes to substance abuse?
We live in a high stress, highly volatile, change oriented society, and with that comes some lack of stability. And I think anytime there's a lack of stability, people look and find anchors in different places. Sometimes it forces people into really healthy anchors, family, faith, activities, and other times maybe for someone who's a little more isolated, or just because they have a history of the past of substance use. Substances in the short term, in the moment, are something that can bring quite a bit of comfort and enjoyment, although it creates a bigger problem over time. People are coming in with a lot of what we call co-occurring needs, so mental health and substance use, as I kind of talked about, like some of the precursors for many people for substances. Just the fiscally, the cost for treatment. There's been some great innovations in regards to the tele option and things like that for the busy schedules and lives that many Michiganders have. But those workforce development, every sector is struggling with finding good qualified people to serve. So those are some of the challenges on our side, but we believe strongly in the mission and are grateful that our country and our state is identifying this month as a Substance Misuse Prevention Month.
And how does Samaritas help?
Yes, so Samaritas is one of many people and providers that are working to make a difference. So we provide a whole variety of outpatient level of care. So not necessarily residential, although we're connected with the residential programs, but for people who can live at home, can come in, whether it is for some individual counseling, some group counseling, medication-assisted treatment for people who are struggling with opioid use or alcohol use, an intensive outpatient program. So being able to get some intensive up to 9, 10, 11 hours of services per week that can work around people's schedules so they can still be productive members of society. Sometimes people need to leave their setting, but they also have to come back to their setting. And so being able to help people stabilize in their setting is really important.
I love that. Thank you for sharing this valuable information with us today, Anthony. Appreciate you stopping in. Thank you.
Absolutely. Thank you.
You are so welcome. If you know anyone that's struggling with the impact of drugs and alcohol, just call the number that's right there on your screen to get connected with resources from Samaritas. You are not alone.